WIAC's new webinar series. My name is Lisa Palmer, and this is Samantha Darcy, and we'll be hosting today's webinar. We wanted to start by telling you that when both Sam and I first saw or heard of this long name here, this 22q11.2 deletion syndrome, both of our thoughts were, what is that? We had no idea. We had never heard about 22q before. So if any of you guys out there listening feel the same, don't worry, you're not alone. Most people today recognize names of other common genetic syndromes, maybe Down syndrome or Fragile X syndrome, but 22q remains a condition that's under-recognized by many people, including people like medical professionals, doctors, teachers, and even patients themselves. So this webinar, we just want to give you a snapshot into what 22q is in the hopes of increasing your awareness and knowledge so that you might be able to spread some awareness about this fairly common genetic syndrome, 22q. So we will do that by giving you a bit of an overview about what 22q is. We'll discuss some of the common developmental, medical, and psychiatric features, along with some behavioral characteristics. We'll discuss some strategies that we've found helpful for supporting individuals with 22q. And then we'll also discuss what we provide at the Dalglish Family 22q Clinic, which is located at Toronto General Hospital.
So let's get started, and we're going to get to the real question here. What is 22q11.2 deletion syndrome? So shortly, it's a genetic condition, and it comes along with it many features. And what do we have here at the top of the screen? So we have DiGeorge syndrome or velocardiofacial syndrome. So one of the important things to know, and why I think maybe that this 22q deletion syndrome remains somewhat unknown, is that as it was being discovered, it was kind of taking on lots of different names. So how did this happen? So for example, DiGeorge syndrome. So that was actually named after a gentleman, Dr. Angelo DiGeorge. And he was a pediatric endocrinologist. He was practicing in the 60s and onward, of course. And so what he found was that when he was working with his patients, he was noticing every once in a while that these patients would have some similar collection of features. So what did he notice? He noticed heart defects. Of course, he noticed, as an endocrinologist, he noticed low calcium, lots of infections, abnormal palate. So he was actually the one who, first diagnosed this collection of common features. But at the same time, and a little bit later on, there were lots of other people noticing this separately. So for example, this one, velocardiofacial syndrome, was from someone named Robert Sprintzen, and he was actually a speech pathologist. And so of course, he noticed issues with speech, with the palate, so that's what the word or the part velo refers to. But he also noticed these other features. Cardio, he noticed the heart defects. Facial, he also noticed some, common facial features that he would see in these patients. So that kind of led to this one single condition having a bunch of different names. And people didn't really recognize that it was all the same condition until, the advent of starting to do genetic testing. And so that's why now we do know it's 22q11.2 deletion syndrome. And actually right now, there is a push for having this condition all classified under the same name. It's called the Same Name Campaign. You can see it actually at 22q.org. This is the International 22q Foundation's website. And we really think that that's, to lessen the confusion, that's going to help with advocacy of this, because if we're seeing patients who are going from specialist to specialist, and one specialist calls it DiGeorge, one calls it maybe 22q, it's very confusing and very hard to get proper diagnosis and treatment. So that is, a big feature of why this has been so tough to pin down. So let's talk more about, okay, we know it's a genetic condition. So what's actually happening? So we have this picture here. It's a genetic condition where a piece of chromosome 22 in our DNA is missing. And so that's, of course, where we get that first number, 22. Now, the Q refers to, there's two arms of this chromosome. Q is the long arm, so that's where it is. It's on the long arm. And 11.2 is kind of like further telling us where it is on the chromosome. It's like a GPS coordinates. So 22q11.2, that pinpoints where it is on the chromosome. Of course, deletion is referring to the fact that this part is now deleted. And syndrome is talking about, there's a big collection of features. It's not just one targeted thing that happens, it's a whole collection of features, which is very important to recognize. So that's what it is genetically. Now, okay, why does this matter? How often do we see it? We have here, it affects, we think now about 1 in 2,000 live births. The number has been, changed a little bit over the years. First we thought 1 in 4,000. I think we're being able to get, genetic testing for more people, and we're recognizing more that maybe this is a bit more common than we used to think. So it's important that we start to look into it and really, advocate it. And the only sure way of knowing whether someone has it or not is through a simple blood test, and from that we can do a genetic test called a microarray. Yeah. So, how does it happen? So what you can see here on our little graph, so about 90% of the time, 90% of the clients that we deal with, it's a de novo genetic change. De novo meaning new. And about 10% of the time it is inherited, from a parent. So what is this? I think, this is a really important part, because what we'll see is sometimes, families are a bit hesitant. Sometimes they're a bit, I guess, afraid, because they don't want to hear, oh, I caused this. My child has this for some reason because of me. And we like to explain that to people and spread the word that, the majority of the time, it's a totally, it's new, a random mutation in the DNA. So it makes, talking about it a bit more accessible. We are definitely not in the business of blaming anyone. Sometimes these things just happen, and of course through research we hope to figure out why one day, but there's definitely not that blame there. And of course, we're not blaming anyone for inheriting it either. But that's an interesting part too. We do see now some of our patients who come through we have some family members. So we might have, the parent who we also see their child. Actually, interestingly enough, sometimes what we've found is that the child will be diagnosed with 22q. And a really important thing that has to happen is when a child is diagnosed with 22q is we would suggest testing of the parents, because we may find that one of the parents was a carrier. Most of the time it's new, but there may be a carrier, and then that person now can get treatment. But that's also maybe a bit jarring, because some people are being diagnosed later on into their life. So it's important to know that breakdown and kind of see the path that people have come on to become, get this diagnosis. And then lastly, one of the big things we want people to know is that expression of this condition is highly variable. So there are lots of different features with it. Some people will have some people will have others, but we really don't want to paint everyone with the same brush, so to speak. There are guidelines we can follow generally, but of course we're treating each person uniquely to their unique needs. So we definitely don't want to look at everybody, oh, 22q, I have it figured out. We still have to do some, thinking based on what their features are. So we will now discuss features, features, features. What are these features? So these ones here that we have shown are kind of the big ones, the ones that we see a lot, the ones that require a lot of treatment, a lot of follow-up. But in reality, 22q can affect pretty much every part of the body. So you also get maybe sometimes some dental issues, hearing difficulties, multiple infections. So there are actually quite a few, that are not mentioned here, but can pop up. And we will talk about our website at the end, where you can find lots more information on all the features. The one thing that's very interesting, and that we have to remember, is that fertility is actually unaffected. So we know there's maybe some changes in people's physical health and this and that, but really fertility is still there. So as with some other genetic conditions, we see it, fertility is affected, not so for 22q. So I know for all of us at the clinic, especially with Lisa, we really want to make sure that we're not forgetting that, these individuals may be considering getting pregnant, considering having a child with a partner. Sexual health and all those other related issues are not off the table, and it's important to discuss for sure. So with these features that we're showing here, some are, very mild. Some can be more severe. They can have one or they can have many. We find on average that individuals with 22q will have about 9 different features that require some sort of ongoing care and attention. And they are often seen by many medical specialists, which later on when we're talking about our clinic, we'll tell you why we sort of function the way we do, because these are definitely individuals who have been thoroughly through the healthcare system with many different healthcare practitioners in play. So definitely there's a part of sort of getting everybody on the same page that can be a challenge, something you have to focus on. So let's dig into each of these a little bit more just to get a good picture going. So heart problems, first off, the cardiovascular system. So we do see, about 75% of our patient population has some sort of cardiovascular issues. Usually, like a congenital heart defect, so you might see tetralogy of Fallot, ventricular septal defects, and a lot of times these will require surgery. So that will be part of a lot of our patients' story, is that as a small child, like as an infant, as a young child, they really had to go through some major surgeries because there's some sort of structural change in the heart that requires surgery. It requires some sort of attention. Palatal abnormalities. So the palate is for referring to the top of the mouth, in and around that area. We talked about Robert Sprinson. He was a speech pathologist. So, of course, speech pathology is one of the specialists that a lot of our patients will see. And what does this produce? What's the issue with the palate? So sometimes we will see patients with very hypernasal speech, so it will change how their voice sounds. We'll see sometimes some chronic ear infections, a lot of palate repairs. And I think what we'll be kind of alluding here to is the thought of this being a bit more of an invisible disability. And this gives an example of that, because you may know a very obvious, cleft palate where you would see like a structural change in the top of the lip. With this, a lot of times it's submucous cleft palate, so it's not easily seen, but of course causes some issues, as a child, a lot of feeding difficulties, these sorts of things. So again, sometimes can get missed, but very big issues there. Mental health, of course, this is a big one. You know, we'll talk about our clinic, who's in there. Our director is trained as a psychiatrist, so a lot of mental health concerns. So anxiety, depression, psychotic disorders would be a big one. So we find 1 in 4 adults with 22q are at risk of developing a major psychotic disorder such as schizophrenia. So important to note that not only, you know, a physical sort of health concerns, really a lot of effects on mental health. And, you know, having to go through, I think, all the things that our patients go through, all the medical specialists, all these, you know, things that they have to sort of overcome can just be, you know, hard on their mental health as well. Calcium and thyroid, so alluding to endocrine issues here. So as a dietitian, that's my background, so I talk a lot about calcium. Many of our patients will have either a history of or currently low calcium, which a lot of times people say, oh, low calcium, so they must have a problem with bone issues and bone health. But actually for our patients with 22q, it's a bit more severe, where the low calcium could actually cause seizures. So it's a bit more than just, you know, drink your milk, it's healthy for your bones. It can be a sort of a larger issue. And they can also have sort of thyroid issues, hypothyroidism. And all these things, of course, interact, right? Calcium supplements would affect the medication that you take for thyroid. So a lot of pieces here we have to kind of get around. Skeletal issues. So there can be, you know, some of our guys suffer from scoliosis, which is a curvature of the spine, neurological disorders, so seizures, again, from calcium, but from other reasons as well. Sometimes we do see someone who has actually been diagnosed with epilepsy. And learning disabilities, which we'll jump into a bit more here. Now, so these are all our common clinical features. Imagine having 9 is the average. So imagine having all of those plus a couple more. It's a lot to deal with. So one of the things, as we were talking about advocacy today, one of the things that we do for our clients, the adults that we see at the clinic, we have this thing called a medical information card. So, and it's obviously, you know, it's free of charge. We will summarize their, you know, pertinent medical history, their medications, and that sort of thing on a little wallet-sized card. And I think, you know, a lot of our clients have really liked that. It's easy to just go somewhere and they can hand them the card. And of course, you know, family members, caregivers, they really enjoy that too. So that's one way that, you know, we're trying to make this a little bit easier. And of course, if you want more information here, we'll talk about our website. Surrey Place actually has a good website on all this too. They're called Health Watch Tables. So Google Surrey Place Health Watch Tables. Tons more information on it. And I think those are the features. So I think we'll pop into a bit more intellectual disability.
Yes. Talking about those, the medical information cards too, for anybody, 9 medical features is difficult to understand and to explain to different medical professionals. But for a lot of our patients, the cognitive profiles also has implications for why this is so important. And Health Watch Table, Dr. Bassett actually did some of the information for the 22q part. So, like all the features that Sam was just talking about, the cognitive profile of people with 22q is highly variable, but we do see a range of some trends and areas of relative strengths and weaknesses. And what we see here is that the overall intellectual levels on standardized neurocognitive testing is shifted over to the left. So if you look at the blue line, that's the general population where the average full-scale IQ would be 100. And we see the 22q population being that red line shifted over to the left with a normal distribution, with the full-scale IQ being around a 70 would be the average. So we see the majority of individuals with 22Q would test around the borderline range, with 1/3 of students falling in the mild intellectual disability range. So it's less common to see moderate to severe intellectual disabilities, although we do still see them. What is common is a lot of the psychological profiles show this discrepancy in scores, with a significantly higher verbal IQ than performance IQ, is common to see in these psychoed reports. So that can be suggestive of nonverbal learning disability. And this higher verbal IQ can often mask the struggle that's experienced by these individuals, and leads to things like frustration from the individual, family members, or people providing care. So this is where this kind of cognitive profile requires such advocacy for supports while in school, and while in the transition out of school and into their adulthood. The other important thing that we've seen is a subset of our individuals with 22Q experience this cognitive decline or plateau around age 11 to 13 years old. So that's just another important thing for academic planning, for managing expectations of these individuals. And also some research has shown that this decline could be an indicator of a risk of developing a psychiatric illness like schizophrenia, which is a treatable illness, but it's important to see. So that's why it's so important to advocate for these assessments to happen, especially while they're in school. And then to get a repeat assessment is, again, important to see if there's monitoring any changes in the scores, so that you're able to access all the appropriate treatments and supports. And the other big thing that that I deal with too is it's important to make sure that they have this documentation available to show whether or not these individuals are eligible for government supports and community supports later on throughout their life. So regardless of cognitive intellectual functioning, we see common behavioral characteristics and behavioral struggles among our adults with intellectual disabilities and without. So there tends to be issues with executive functioning, like things like planning, multitasking. They often have impaired insight, so limited insight into what their medical conditions are, what their specific functional limitations are. They tend to have impaired judgment, especially in things like social situations, and they really have this overall general impulsivity. So we'll see common things like impulsive spending. We see major problems with internet safety, general risky behaviors, and in adulthood, really risky sexual behaviors, both online and face-to-face. But on the other side, it's also common to hear that these adults are quiet, shy, very socially isolated, and just completely uninterested in social interactions, relationships, or dating. It's also common for individuals to display some of the communication or social skills deficits that are sometimes seen in people with autism. So things like reduced use of gestures, repetitive behaviors, repetitive speech or questions, becoming really fixated on things and have difficulty letting things go. We see that a lot. So this is where some social skills training might be recommended for these people. They also may seem younger than their chronological age and tend to relate better to younger age peers. They tend to have poor coping abilities and sometimes trouble managing their emotions. So we'll often hear the term attention seekers when describing this inability to cope with stressful situations or anxiety-provoking situations. We have the mental health that Sam was kind of talking about, the anxiety. It's a lot of anticipatory anxiety. So when they have a meeting to go to or a doctor's appointment coming up, that's an extremely stressful emotion to cope with. So this is where sometimes emotion-focused therapy, emotion regulation strategies with really direct support and repetitive support can be really helpful. So they tend to have a lot of difficulty with advocating for themselves. So again, this is where kind of the pieces from our clinic come in. They're often not the ones to ask for questions or ask, to speak with a lawyer if they needed to. So they can be really vulnerable to signing things too, without asking questions or without asking for clarification, will often hear, yeah, I understand, when in fact their comprehension might be quite poor. And so they're at risk of signing something that they really shouldn't. So these sets of behaviors, struggles, can lead them to be quite vulnerable, both as children and into their adulthood, and again, and both as victims and perpetrators. We have people often coming in and they've been taken advantage of emotionally, financially, sometimes sexually. And we also have people coming in who've kind of harassed other people online, not really being aware of these social cues, social rules. And it's also, again, Sam talked a little bit about the invisible disability. And I think that's really important to talk about, because often when you're just looking at somebody, you cannot tell that they have 22q. We've kind of moved away from using what they used to call dysmorphic features. We've kind of moved away from that because a lot of people don't have those. So when you just look at somebody, they don't look impaired. So we've had multiple family members have said to us at clinic, they kind of wish that their loved one had a more visible disability, like a physical disability or even Down syndrome, so that people would be more understanding into their impairments and limitations, instead of coming across as, other characteristics like lazy, unmotivated, or even rude. We hear a lot of, they're just being rude. So it's just important to be aware of this. Sorry. So we talked a lot about the struggles, but there are also a lot of relative strengths that we want to point out. So they tend to have strong rote learning, memory, and verbal recognition, which means that many of these patients are good at reading for information, they're good at writing and spelling. They often do well with visuals, they're really good on the computer a lot of the times. So that's where things like assistive technology comes into, can be really helpful. They're really good at when instructions can be given in a step-by-step or sequential style. So lists are really good. Employability and activities of daily living tend to be relative strengths. So they often do better with hands-on tasks, hands-on learning environments where they can gain mastery into things. So in school, they often do really well in co-op programs, volunteer. We also have many adults who come into the clinic who are successful completing college degrees. We're often also told that they're the ones who show a willingness to learn. They're really dependable on the job. And we often see other strengths and talents in our population. So people who are very musical, very artistic. We have a lot of accomplished musicians, people who are good on the violin. We have pianists. We have professional photographers, some athletes. And we also have many individuals that are just very successful in part-time or full-time jobs. They've been in for many years. So it's going back to all the different features of 22q. Unfortunately, there is no cure for the actual 22q deletion. However, each of the separate conditions that we've discussed can be managed. They can be managed and treated with appropriate support and treatment. And with individualized appropriate supports, access to suitable programs and services, many of our individuals with 22q are living successful, happy, and very fulfilled lives.
And if I just jump in, because we're talking about the computer skills and that, I just was talking to a client this morning, and for me on the sort of the dietary side, really a lot of our clients love, apps using sort of computer-based ways to sort of manage their health. We keep seeing multiple of our patients keep finding this one app for healthy living called Carrot. And it's just interesting there. We've said this, like we focus a lot on, what are the concerns? How do we support that? But, definitely there are some ways to draw on the strengths to facilitate that treatment. So,
So talking about best ways to support. So again, everybody is different and everyone will do well with individualized supports, but these are some common strategies that we've found helpful. in supporting adults with 22q. So again, going back to matching expectations to cognitive and social capabilities, so important. And we always direct people, if they haven't had a neuropsych education, to get one, and use those as a better way to direct for individualized supports. Use the recommendations there. It's often helpful to give one instruction at a time, as their brains often struggle processing information that's just bombarded to them. So they may need more time than would be expected to process information and then to act upon it. So just giving them that second to process the information before asking another question is a really useful strategy. It's best to use simple, concrete language, avoiding using abstract concepts or sayings that are not meant to be taken, or that are meant to be taken literally. So like, don't say things like button your lip or let's hit the road. Sometimes they get a little bit confused there. It's best to avoid using analogies, probabilities, or statistics. Repeating instructions, again, clarifying understanding. Because they say, yes, I understand, but then when you ask for clarification, that's when you have to have a little bit more detailed discussion around.
And I find it's almost like they'll come back to the same question, and then it's changed a little bit. So definitely a few passes will help get the bigger picture.
It's best to use visuals, having written instructions or simple diagrams. And providing, I don't have it up here, but structural routine is so important. That's why a lot of people do actually quite well when they're in school and they have this structured routine. And then during the transition, summer vacation or transitioning out of school can be quite a difficult time for these individuals. And just, in general, strategies for supporting anybody with these kind of disabilities are just praising successes and achievements, encouraging positive behavior changes, and because of the anticipatory anxiety, just focusing on the present situation, because they tend to have that worry about things that are coming. So just staying calm, the most effective way to communicate. And again, due to these variable, complex needs of these patients, involving people, so involving their caregivers, other staff that are involved, teachers or other support workers, and collaborating care plans will also help these individuals to be as successful as possible. So we'll talk about our clinic a little bit.
All right. So we gave you kind of a big go around, all the things you want to think about when you're, if you're supporting someone with 22q or is looking for more information for that. So this is where we get to the part where we get to tell you, you know what, we're here. We're in Canada, we're close to you, presumably, somewhat close. So please, we'd like to make the case for, we can be that support. So why come to us? What do we do? So this is our clinic here. You can see at the top, here's our nice little logo, some pictures of our clinic space. We are actually the first clinic of its kind in the world specializing in adults with 22q. Now, you may know there are other clinics around the world, of course, more and maybe a bit more focused sometimes on kids or not particularly specializing in adults. But this is what we do. And we do have down here the logo for Sick Kids Hospital. And we'll talk about how we collaborate with them, but they actually do have a little specialized area where they would see kids with 22q. So it's actually a really nice partnership, a nice way to link up, because the care, it's not just going to end. We want to make sure that, from the day they're born and we identify this, we can provide that care. So that's really, we're not discharging our patients once they're in the fold. We will follow them, for life. And so we provide sort of that specialized, that patient-centered care. to these adults, but also to their families, their caregivers. I think that's a big thing that people don't understand is where our clients, desire it and where they need it. We definitely, anybody who would be a benefit for our client to bring in, to involve in the process, we absolutely will. So yeah, this could be, a family member that the client really wants to have with them. And not to say that everybody comes to see us with someone with them, but a lot do. And, they just seem to like that support. And also caregivers, we do have we have that flexibility when we're seeing people to spend a bit more time where it's needed, because I think a lot of times it is needed, and to get multiple caregivers around the same table. A lot of kind of case conference type things where it's hard to bounce information over here to this specialist and over here to this one, but we're really in the business of just get everybody in the same area and work together to make plans. That's what we really like to focus on. So it really is a framework for integrated care, not only for 22q, but we hope for other complex conditions. There really is benefit to having sort of this interdisciplinary care model, where, it's not on the one physician to manage all these different pieces, because that might not be, realistic. And most importantly, we do accept referrals from healthcare professionals from Ontario, but also across Canada. So we have people from, some in BC, Nova Scotia, maybe some other places.
International patient from Paraguay.
Yeah. So even, and some of our patients I know some live in Indonesia or Australia, I think. Australia, moves around. So really, but we're open, we're going to continue that care as they need it, no matter where they are. So, and you can see through, I'll talk about our website in a second. Yeah, we can go through here. So more about our roles. So we talked about we're interdisciplinary team. So how would it look? So we have right now 3 psychiatrists who are working. There's of course Lisa as a social worker, myself as a dietitian, and we really do work immediately together. So if you're worried, if you were supporting someone and you said, oh, I know I want them to see a physician or a psychiatrist because of a mental health concern, but also, for a dietary concern or social work. So we have you covered. Come here and they would see us, all together on the same day if they need it. And we also do, so I talked a lot about the one-to-one. So we do those individual assessments, that sort of one-stop shop where you get to see everybody. But we also do group education sessions. So tell you a little bit about our peer support groups in particular. So Lisa and I run these. On one hand, we have the caregivers who can come together if they like and just sort of share, their concerns, what's been working for them, and sort of bounce it off people. Lisa, often one of the physicians will come in. And then for the clients, usually would be with me, and we'll do, some education, something usually dietary, but just to, make it worthwhile for both parties and help for, treatment. Diagnostic testing. So this is a really big one we want to underline is we do see individuals who are suspected of 22q. There's no, we want to just say there's no dumb questions. If you think there may be your client may have it, or you just want to be sure, we can arrange for the proper testing. We know what it is. We work with this all the time. So if you're just like, I just don't even know how to go about doing that, don't worry about it. We will take care of that for you. And of course, consultations and coordinated care within University Health Network, within UHN. So not only do we have us, who work in the clinic day to day, but we also make sure that where it's needed, if we're able to, we can get those other specialists involved and get them involved in a way that is most beneficial and easiest for the client. So we, most importantly, we work very close with the congenital cardiac team at Toronto General Hospital. So for instance, and you saw the picture of our clinic, it's a very nice, quiet, calm place. So instead of having our client, let's say they're from Thunder Bay, they need to take a plane in, they have to do their yearly cardiac checkup, their physician, they have other concerns for dietary or social work. You don't want to be bouncing around all over the hospital. Where's this place? Where's this place? So those cardiologists, those doctors will actually come up to our clinic and see them right there. We'll also get the ECG tests and, some of that cardiac testing will also come up. So we talked about, mental health concerns. Anxiety is a big one. How many times would a client maybe refuse to do these because of that anticipatory anxiety? We want to get rid of that. We want to reduce it. And I think we really do find our clients come in and they find it's a nice quiet space. They, we have good rapport. They like being there. We have, some tea, some water. They can just have a nice relaxing time. We really, that should not be seen as just a trivial thing. It's really quite important, I think. Of course, we also would give referrals within the community. We do, we're slowly over our years have built up a good list of lots of different specialists who now, through us, understand 22q. They're, better acquainted with the uniqueness of this condition. So we can definitely, even if they maybe don't need to come right here, is there someone else maybe for sleep? Endocrinology, that's in UHN, but we have partners in the community. And we talked about
the sick. So
yeah.
we have a really fantastic transition program with the Hospital of Sick Children. So it's a full day transition day for the client and their family members over at Sick Kids. That's a number of different workshops, education, their last appointment with Sick Kids, so they kind of do a wrap-up with their genetic counselors, doctors at Sick Kids. They get to meet our team, and then we get to physically walk them over to the new clinic space. So it's quite for them, it's again very concrete, and it's quite wonderful. And then they get to meet all their new doctors, their new team. They set up their first appointment with us, and so we have another one coming up actually in April next year.
Yeah.
And sorry, just going back to that, so that the adults, youth will transition to our clinic around 17, 18, but we do get sometimes earlier referrals if there's major issues, either psychiatric or other things that they need to come to our clinic earlier.
Mm-hmm. So again, don't be afraid to reach out, even if you're not sure if they totally fit all the criteria. We'll get you to the right place. And then more, we do a lot of education. So today, hopefully, we've given you some useful information. We have actually really interesting, the Sick Kids, they, through working with actually some caregivers and some family members of individuals with 22q, have put together a yearly family conference. So we'll go and present at that. There are international 22q conferences, so we try to make sure that we are getting in touch with people all over the world so we can bring the newest knowledge. We want to make sure we're up to date. And then research as well. So this is a really important piece because, you know, through the research that we're doing and the other centers are doing that we're linked up with, you know, we're really the ones having to build these best practices that we then take to our client base, because, you know, many of you didn't know what 22q was before this day, and it's not a big maybe focus sometimes for research. So how do we say, you know, this is what we recommend? We do that because we have this research. We do it to provide the best care for our patients and continue evolving that care. And a lot of our clients that we see, you know, they're involved in the research. We make sure we take the time to sit down and explain it to them, explain why they might want to be involved and what they get out of that. Because a lot of times, you know, they might do one where they get a bit of an assessment, that can actually help them then later on. So a big thank you to all our patients and clients, because they really are the ones who are building that research base for the next generations, and we think that's really wonderful way to give back, and it's really important. Yeah. And okay, so here you have some information. You have our phone number, our email, but all that stuff is on the website. So 22q.ca. Simple, as basic as we could get it. Really check it out, because if you think you learned information here, go to the website. There is so much there. Information for patients and family members, for health professionals, for educators, links. We just want to get it out there. We also have a Facebook page if you're so inclined. And yeah, remember, reach out, no stupid questions. We will be that resource for you in the community.
Okay, well, thank you very much.
Yeah, thanks, guys. Check our website out.